Great to have everybody here. So we're going to talk about COMT, mood, and health. As a disclosure, I do own a clinic, InnerSource Health, in New York City and Huntington. I do formulate for one company. I make mood formulas. And then this information is for educational and is not medical advice to treat or prevent any medical condition. And you should always speak to your licensed physician for your health. And I do mean that because, we go through a lot of information, and it's really important if you're not working with a medical practitioner that you do work with someone who can really adjust it for your needs. All right. So I'm going to stop the video and let's get to talk. And so the first thing I wanted to mention is what we're talking about today. So if there are 2 points to this video. One is that the COMT gene, which we'll talk about, can either increase stress hormones and estrogen, and that there's another one that can lower them. And then if you know your COMT gene, you can use natural remedies to bring balance to that. So we're going to obviously fill that in further. It's important to remember that this should be in a greater context, right? So when we talk about genes, I just wanted to briefly go over that when I work with a patient, I usually do a very thorough intake. I do labs. We look at blood work. We look at urine tests. We look at genetic testing. And then based on the intake and all of those testing, then we make decisions about how to work on sleep and exercise and a person's thoughts and their stressors and getting them out into nature and giving them the right foods for them and possibly detoxifying and adding the right supplements and maybe other modalities like acupuncture and Reiki or massage therapy or whatever's appropriate. And then if a patient's on medications, especially mental health medications, then we can have that discussion and the discussion with the prescribing doctor about successfully and safely weaning off. So when we talk about genetics, we want to talk about it in this greater context. So when we talk about genes, what we're talking about is our DNA. So this is a picture of DNA. And if you look at these little ladder-like areas here, if this was a ladder, these would be the rungs that we would step on. Each rung is composed of 2 parts, and each part represents a code, specifically an adenine or cysteine or thymidine or so they're a guanosine molecule. And each of these will individually doesn't really do anything. But when you put them in a certain order, that makes up your DNA blueprint. And that whole blueprint is what makes up your book of life, is what makes up the information that helps your body create you. So every cell in our body has the full complement of genes and DNA that you need to make all your body parts. And then what happens is, as we grow as an embryo, the cells start shutting down which DNA pieces get used to make certain proteins, to make certain organs and organ tissues and things like that. So, but each DNA has, each cell has all that information. And what we're looking at today is one specific part of the DNA that codes for one specific enzyme. And when we talk about a SNP, and we'll go to the next section, when we talk about a SNP, what we're talking about are these little codes. One of them is being changed, and all the other ones are staying the same, right? So we're looking at one particular SNP, one single nucleotide polymorphism, which is a fancy way of saying one little part of the code got changed. And sometimes, in fact, most of the time, when the code and the DNA gets changed, it doesn't really mean a whole lot. But if you have an enzyme that's small, then maybe that becomes more important. Or if that enzyme, if that part of the code codes for a very specific part of the enzyme that has an important function or fits in a certain way into how its functionality works, then that might become more important. So sometimes these mutations or SNPs are important and sometimes they're not. So this particular one we're talking about today, Compti, has one SNP change that when it's changed, it's important. So COMT stands for catechol O-methyl transferase. And what it does is it codes for an enzyme that helps our body break things down. So when you talk about methyl transferase, you're talking about adding a group called a methyl group to something. And in this example, in this picture here, it's dopamine. And when you add the methyl group to it, it breaks it down into something that becomes inactive. So dopamine here becomes 3-methoxytyramine, which doesn't work the way dopamine works. Dopamine creates motivation in the brain. It creates movement. It's one of the things that lifts you up. When there's too much, you can even get a little bit manic. And then when it gets broken down, then dopamine can't do that anymore. And that's what COMT's job is, to methylate that molecule so that it can't be used anymore. And typically it when it gets methylated, the body can carry it out. Okay, so what does COMT metabolize? What does it break down? It breaks down a bunch of stuff. It breaks down catecholamines, which for mental health is very important. So things like dopamine, right, which is the molecule of motivation. It breaks down epinephrine and norepinephrine. In England, those are known as adrenaline and noradrenaline. And those are made, those are our stress hormones, right? So when we get really stressed out, those go up and they make our heart beat fast and hard. And, and when we're running from the bear, they're great. So we also have catechol estrogens. So, and those are estrogen metabolites that have these special structures called catechol structures. So they're like catecholamines. So COMT helps us break down estrogens, basically. So for women who tend to have very high estrogens, and maybe they have a risk factor for breast cancer, checking COMT might be a good idea, because it might be an explanation as to why the estrogens tend to stay high. Maybe they're not breaking it down because maybe this enzyme doesn't work well. And then it also breaks down certain drugs, and drugs that also have that catechol structure. So things like glutamate blockers, which are used in Parkinson's disease and also used for high blood pressure, and guaifenesin, which is also used for, it's used as a mucolytic. It's used to break down mucus. And then substance with catechol structures as well. So in our foods, and we'll talk more about foods later, but one example is green tea. So green tea has catechol structures. And for some people who have certain versions of this enzyme, that can be a plus or a minus. For example, some people, when they drink coffee, they don't have as much of an issue with coffee, but when they drink green tea, boy, they really feel it. And that's because they have certain versions of this enzyme. And we're probably going to focus mostly on the catecholamines today, since we'll be talking a bit more about mental health, but we'll be talking about health overall. So this is a schematic that I'm putting together at the moment, and it's probably changing a little bit every day. But this gives you a general idea about how the COMT works, right? So for example, at the top here, we have tyrosine. Tyrosine is an amino acid that you can take in through food. And tyrosine gets changed into L-DOPA, right? This is another gene called tyrosine hydroxylase, which creates an enzyme which helps make the L-DOPA. And then the L-DOPA becomes dopamine through another enzyme called dopa decarboxylase, right? And then dopamine, it goes through the brain. It helps create motivation and makes us happy, and we feel rewarded. And then it needs to be broken down, because we don't want to keep too much dopamine around, right? Too much dopamine, and you start to get a little psychotic, and you can have really difficult recurring thoughts and things like that. So dopamine is good for us up to a point, and then too much, and our body starts to break it down. And it breaks it down through a few pathways. One is through monoamine oxidase, which is actually another gene that codes for another enzyme, and that's probably another lecture we'll have, but you can see the relationship. And then this, the acronym is DOPAC, gets broken down by COMT, right, by the Compti enzyme, and it creates homovanillic acid, HVA, which gets put out into the urine. And you can test the urine for that. In fact, we do. And dopamine through another pathway gets broken down by dopamine beta hydroxylase, which is another gene you can check as well. So one of the points I wanted to make with this diagram is that, not to confuse you, and you don't have to remember any of this, but I think it's important to note that there's a lot of genes involved, right? It's not just COMT. So it's good to look at them in context and not just look at one gene by themselves. So this dopamine beta hydroxylase breaks down dopamine into norepinephrine, and that can go through two pathways to eventually make something called vanillamidelic acid, which also gets brought out into the urine. And epinephrine, actually, when there's a lot around and it's not getting broken down enough, it starts creating a lot of inflammation in the brain, which can be an important reason why people can get mental concerns, health challenges, because their brain is just very, very inflamed. And when the epinephrine is too high and isn't getting broken down by COMT, either because there's just too much of it or because COMT isn't really functional, then we end up with things like formaldehyde, ammonias, and this methylalamine in the brain. So, and you'll see that a lot in patients. You'll see it in people with things like autism and schizophrenia and other conditions where epinephrine is very high. And again, epinephrine is something we can check levels in the urine. And that'll help us understand a little bit more about why a person's brain is feeling that way and why they're having the mood that they're having. So I wanted to break it down to make it simple, because when you read the literature about genetics, they throw all this different nomenclature at you. They met, AA, plus plus, and it's hard to know what's what, So I wanted to break it down this way. There's two forms of the COMT gene that we should think about. One is the too slow version, which, if you read the literature, it could be met, aka AA, aka plus plus, which is just different ways of saying the same thing, that there's a certain type of mutation that doesn't allow the enzyme to work very well, and a lot of catecholamines and estrogens hang around, and people are more of an anxious type and what's called the worrier, and they have the worrier gene. Right. So, and that's represented by the turtle. The enzyme, because of the mutation, the enzyme's working too slow, and because of that, it's not breaking down the catecholamines and the estrogens. So there's a lot around. So that person can have anxiety. They can have more risks of hormonal cancers because of the extra estrogen. And we'll talk more about what that means. But they're the worrier. So the slow turtle, slow worrier. Then there's another form of the gene where they have the valine type, the val, also known as GG, also known as minus, and they're the rabbit, right? They're breaking it down very fast, maybe too fast for them. And they'll have low levels of neurotransmitters and estrogen. So they're pretty much the opposite of the too slow version. And those people are the warrior. They're the ones with the low mood, the poor focus. And they're also the warrior, and I'll explain more about that in a second. And then there's also, by the way, one that's right in the middle, where they have one met and one val, or one A and one G, or one plus and one minus, and they're kind of in the middle. They break down some, but they don't break down as much as the fast, right? And so I put a chart together to kind of explain this and put it into a little more detail. So again, the same thing. The people who are too slow, they're the met, plus, AA. The too fast, the val, minus, GG. And they're 30% of the population, the too slows. And the slower are the 50% of the population. So most people have 1 in 1. And then some people who are too fast are about 20% of the population. So the question is, what's the best one to have? And the answer is it really depends on you, right? If you have the met version and you're too slow, that's not necessarily good or bad. It just depends on you. If you're very anxious, so let's talk about the drawbacks versus the benefits. So the drawbacks, when you have that too slow gene, and that's how I'll refer to it from now on, is the too slow one, the one that doesn't break catecholamines and hormones down. They're the people who are going to have a lot of anxiety, possibly obsessive, compulsive thoughts, really more obsessive thoughts, not as much obsessive compulsive, but more, they're going to have more pain. They're going to be more sensitive to pain. They're going to worry more. When there's an issue, they're going to focus on it, not able to let it go. Their heart tends to race faster. They're the ones who get higher blood pressure. They're sensitive to stimulants, right? So they're the ones who will not take drugs because it's always a bad trip, right? Or things like even Ritalin, as an example. Insomnia, paranoia, maybe schizophrenia if their dopamine's very high. Impulsivity. These are the young teens who are very, very impulsive, and you say, gosh, I wasn't like that when I was a teenager. Fibroids because of the estrogenic concerns. They'll also have more cravings for things like alcohol because they want to calm down, right? But there's also benefits. So when people who are too slow, quote, too slow, right, with the COMT gene, and they're in balance, they tend to have really good memories. They're smart. They have higher IQs. They tend to be organized. They're good learners. They tend to like to explore more. They problem solve. They generally just do not get depressed. No matter how bad things get, they're not the ones that go down. And they keep at things. They're the ones who can kind of focus and stay at it until they get it. So they tend to be good students. They also tend to have pretty good skin. So there's benefits and there's drawbacks to these, right? And then the slower version, it's going to depend on the person. And the one that's too fast, when they're breaking things down too quickly, they're the ones who have cravings and addictions at high levels. And the reason for that is because they're the ones who have very low things like dopamine. So when they do things like that are addictive, like let's say gambling, kind of like high risk behavior, it shoots their dopamine up and they feel more like themselves, and I always think about that awful time in Las Vegas when that person went to the 32nd floor of the Mandalay and brought all those guns in, and he gambled for a few days and did what he did there. And then he, waited for that concert and he shot all those people in such a horrible way. And I know that person was put on some kind of SSRI maybe about 2 months before. Now, I'm not blaming the drug, but my guess is this person probably had the COMT gene that was too fast, and they were put on an SSRI, which raised serotonin, which probably imbalanced dopamine even more and made it more likely for that person to look for these risk behaviors and do these kind of awful things. I mean, if you want to shoot up your catecholamines, what better way than to do something like that, right? So I just think that, these things aren't just in theory and in the research papers. These things, these issues are, these genetic issues are playing out in real life too. And unfortunately, sometimes in not so great ways. So risk behaviors, they tend to have more nausea, sleepiness, low motivation, not a lot of interest in things, fatigue. They're much more likely to have depression, and they struggle in relaxed situations. These are the people that don't really calm down. They don't really enjoy too many things. They really they have to do something really extreme to kind of enjoy it at all. And they tend to get more Parkinson's as well. So, but when they're in balance, which many are, these are the people who tend to be less anxious. You could put them in very anxiety-provoking situations, and they're cool because it doesn't faze them. It's not even bringing them up to normal. So they're still, and those people, right? Who they could be in any situation, and they're still half asleep. And they tend to be better at stress and high pressure. So when they're in balance, these are the people who can really handle high pressure situations, surgeons in trauma centers and in the middle of a war. These are people who don't get stuck on ideas. They can go to one thing and they can move on, go to the next thing, and they can move on. Where the people with the slow COMT, they're the ones who tend to hang there and they can't stop thinking about the same thing. So they can move on from one thing to the next. So the worrier, too slow, the warrior, too fast. All right. And I'm not going to read through this, but there's a lot of literature showing that certain drugs will help certain people with certain forms of COMT. And I will be posting this, so you will be able to read this at a later date. But it just gives you a sense that certain drugs, and this is why now they're starting to run something called the Genomine test, because you can look at certain genes like COMT and help decide possibly which drugs might work better. And sometimes it works, sometimes honestly it doesn't. But I think the theory is interesting and it's starting to prove out in some of the literature. This I thought was really interesting. It has to do with heart disease. And what they found was people with the fast COMT who took aspirin for prevention of heart disease actually had an 85% increase in the rate of cardiovascular disease. And this is a women's study. So very large women's study, I think about 6,000 or so women. And what they found is that for the women who had the slow COMT, the one who kept a lot of extra catecholamines around, there was actually a 40% decrease in the rate of cardiovascular disease when they were taking aspirin for prevention. So, and if you look at the literature, it's very mixed about how well aspirin works and whether it works at all. And this is probably one of the reasons, in my opinion, before we start taking something like aspirin for cardiovascular disease, we should really be checking our COMT, right, to give us a better idea. Okay, so what about placebos? Well, the people who have slow COMT, right? They're the ones who have the high catecholamines and the high hormones. They have a much more positive response to placebo. So they're the ones who, you say, here, take this, you'll feel better. And they do feel better. So because their body wants to feel better and all these hormones are ready to make a change and they just needed a little catalyst. So they got it, they took the pill, and boy, that really helped in a day. So for whatever it was. And sometimes we know who we are, right? And the people with fast COMT who break down those neurotransmitters really quickly, they'll take the real thing, they'll take 5 of them and it still doesn't affect them, right? So we get a much stronger placebo response with the slow COMT and the people who are in the middle, and a much lower fast COMT response, much lower placebo response in the fast COMT people. So, and this says, I'm not really a doctor, I'm a placebo. All right. So how do you test and analyze for SNPs, for these SNPs? So in general, this is what I do in my patients. There are a few different companies that do this now. I find the easiest thing is to have my patients run 23andMe. And once you run 23andMe, you get the raw data. And then the raw data comes in as a zip file. And then I can take that raw data and do one of two things. In the beginning, when we first started running these things, there really weren't any analysis programs to plug in the zip file. So I would read through it and look for the genes I want to see. So if you look here, you'll see 1, 2, 3, 4, 5 lines down, the RS4680. And on the 22nd chromosome, and this gives you the position, and then the genotype is here. So here's the AG. So this is someone who's not a slow COMT and not a fast COMT. They're kind of in the middle, right? And this was one of my patients who came in, and they had some anxious issues, and so we were looking at their COMT. So they had one that was in the middle. Or you can plug it into an analysis program. And there's a couple of good ones out there. I use Pure Genomics, which is a physician program. I also use Opus 23, which is another physician grade program. And so depending on, what I'm looking for and at what level of detail, I might use different programs. And this is a program from Pure Genomics that is for a woman I was working with who had a lot of anxiety, and she had the AA variant here. So, okay. So that gives you an idea. Oh, yeah. And that's just pointing to that RS number there. So you can comb through the raw data. If you use the search and find feature, it's actually pretty easy to do. And as long as you know what genotype you're looking for, if it's an A or G or an AA or GG and what those things mean, then you can interpret it, even without any analysis programs. So what are the recommendations? So now we did the genetics. We have a sense of whether you're fast or slow or somewhere in the middle. So what do we want to do? So as far as lifestyle goes, and you probably already have an idea from what we talked about, but as far as lifestyle goes, if you have a slow COMT, you're the kind of person who needs more calm and more quiet. If you're too fast to COMT, you want a little more action, right? Because people who are fast in COMT, they tend to not do well when it's quiet. Those are the people who, if you ask them to meditate, they'll lose their mind. They're like, no, that's never gonna ever happen. I can't do that. And that's because they actually do need a little more movement. Whereas slow COMT people, they tend to do better. Now, if you've never meditated, then honestly, it's usually tough at the beginning. But the slow COMT people tend to start doing really, really well with it. Whereas the fast COMT people, it just makes them feel worse. So, okay, so exercise and COMT. So the people who are too slow, again, they're making a lot of catecholamines. They're making a lot of hormones. They tend to need calm and quiet because exercise, again, raises norepinephrine specifically and does raise your stress hormones. And that's a good thing for most people. But for people who are imbalanced, they probably will do better if they're slow COMT to do yoga, Tai Chi, and gentle movement. And for the people who have a fast COMT, they can use a little more movement and a little more action. They could do, they're the warriors, right? They can do the combat stuff. They're the ones who do more of the CrossFit at a really high end way of doing it. And they can do more vigorous exercise. Now, it's not to say that someone who has a slow COMT can't do CrossFit or combat training or boxing, but they need to be much more in balance and they need to work into it. Whereas the people who are too fast, they tend to probably get there quicker and can handle it because it's just right for their body from the beginning. So again, having this gene isn't a sentence that means you can't, do what you want to do with your life, but it means you need to know your body. So this way you can adjust slowly and build up what your deficits are so that they become advantages. And here's one study from one of the neurobiology journals, the impact of aerobic exercise on how they affect and associated to the COMT polymorphism in young adults. So what they saw is that people who ran and had the fast COMT, their cognitive performance improved to a greater extent compared to individuals carrying the MET allele and had the slow COMT. So, and that kind of makes sense. The fast COMT people, they burn through their catecholamines and their norepinephrine. So when you got them running hard, it raised their norepinephrine and that helped their cognitive performance. So they're going to get more benefit than the people who had the slow COMT. So what about foods? So foods affect COMT as well. So these are foods that are probably good for slow COMT. And conversely, you probably want to avoid for fast COMT. So these are things like cruciferous vegetables. Now, why things like that? Because those break down estrogens. And generally, people who have slow COMT tend to have more estrogens, right? Because they're not breaking them down. So again, flaxseed and soy, because soy helps modulate estrogen. And then avena sativa, which is oats, very, very calming for people with slow COMT. And then lower protein. Now, why lower protein? The reason is because when you eat a lot of protein, you're going to be eating a lot of amino acids, things like tyrosine, and that tyrosine has to be used for something, so it gets made into more dopamine. So the more amino acids you make, the more catecholamines basically you're going to make. Not that you shouldn't be eating any protein, and certainly you need enough to support your muscles, and if you exercise, you need more, but you may want to be on generally a lower protein diet. So these patients, not exclusively, but as a very general rule, probably do better with more of a vegan, vegetarian style diet and lower proteins, and maybe some of that protein from soy as well. So people with fast COMT, what do they need, and what should the slow COMT avoid? So protein, again, so you want to add protein for these patients because you want them making more dopamine. Excuse me. Beer, alcohol, and red wine are estrogenic and should be minimized by those with slow COMT. So I'm not saying people who have fast COMT should be drinking a lot of beer, alcohol, and red wine. It's got to be appropriate for them, but those are the people who could probably handle it more because it also raises the catecholamines. For example, I have a lot of patients who, excuse me, they'll drink red wine and they'll wake up and their heart's pounding in the middle of the night, right? So those are probably the people with the slow COMT, where they already have high catecholamines, and red wine can actually increase that, right? Red wine actually also increases histamines, and that can increase catecholamines. But the point is, if you want to do better with the alcohol, it's probably the fast COMT people. And then berries, bananas, cacao, chocolate, and citrus also have levels of catechols in them. So some people who are very sensitive are going to get affected, and some people know they can't even eat chocolate at night. And I have seen a few patients even berries, right? Excuse me. And then coffee does slow COMT as well. So if you have a fast COMT, coffee is actually a pretty good idea because it'll be a little bit stimulating. It'll raise your dopamine because it slows the COMT enzyme. And green tea and black tea, as we said earlier, also have catechols in them. So that might be appropriate for the fast COMT person. And and I put adding protein twice. So it must be important. Okay. So I thought this was an interesting study on green tea and breast cancer. And what they found was out of almost 600 patients, there was an association between the green tea intake and breast cancer risk, but only among individuals who possessed at least one low activity COMT allele. So low activity, excuse me, meaning it was slow. So their catecholamines and their estrogens were higher. So for those women, when they took green tea, they had a more beneficial effect in terms of being protective and reducing the risk of breast cancer. Whereas the people with a fast COMT, who are already breaking down the estrogens, didn't have as much of an effect. So it should be noted that pollution can also affect COMT. Mercury specifically inhibits COMT. I had 2 patients just this week alone. We took a look at their mercury levels and they were quite high. And I had one of those patients had very, very high anxiety. And I thought to myself, well, that mercury's high. Their COMT is probably slow. We hadn't checked it yet, so I'm not sure. But certainly that mercury, even if their COMT is normal or even fast, that mercury is going to slow it down. And then this one second bullet here says occupation, excuse me, with cooking oil, fume exposure, and soot exposure confer a greater risk for lung cancer among non-smoking women with polymorphisms of COMT. So what they also notice is that when you have certain versions of the COMT, you're going to be more likely affected by pollution as well. And just as a side note, because obviously it's so important to all of us right now, about 8.8 million people, this is pre-COVID, were found to have premature deaths because of pollution. Excuse me 1 second. Talking all day, goodness. Okay. So almost 9 million deaths premature because of pollution, and an average loss of 2.9 years of life expectancy because of pollution. Now think about that. Almost 9 million people. Now we know COVID is a terrible thing, right? But we haven't approached 9 million people died this year. And yet every year, and it's only increasing and increasing, we're seeing millions and millions of people die directly because of pollution. And emerging evidence suggests a positive association between long-term exposure to ambient air pollution and COVID-19. So in other words, the more polluted your air is, the more likely you're going to have a problem if you catch COVID. So not only does pollution affect COMT and slow it down, but it also changes our life expectancy in general in a great way, and also changes it even more if you get COVID. So what nutrients are good with what forms of COMT? So there's a lot of supplements out there and it gets very confusing. So sometimes knowing your COMT can help. For example, we know that COMT needs magnesium and methyl donors, and we'll talk about what those are. So for slow COMT, some of the supplements that would be good would be things like magnesium. That's usually the first thing I give patients. It's very calming to the nervous system. And then SAMe, excuse me, SAMe is well known to be helpful for mood. And it's one of the strongest ways to support methylation. It also is very important to support muscle mass and muscle gain. In fact, your body can't create muscle unless you have enough SAMe around. It also, choline is another substance that helps methylation. Choline tends to be very low in pregnancy. And there aren't a lot of foods that have choline. Things like eggs have choline in them in larger amounts. Vitamin C also modulates dopamine and adrenaline, so that's good for slow COMT. DIM, which is diindol methane, which is it's basically a component. It's of brassicas, right? So we talked about earlier how helpful it is to eat brassicas like broccoli and Brussels sprouts and bok choy and things like that. Well, this component DIM can also be taken as a supplement, which is very good to help lower aggressive estrogens. And then lithium orotate. Lithium orotate is a mineral, not the drug lithium, that's lithium carbamate, but lithium orotate is a mineral that can help calm the fear centers of the brain, help calm the amygdala, help calm the hypothalamic pituitary adrenal axis, which helps calm our whole body. It raises brain-derived neurotrophic factor. It raises oxytocin in the body, which gives us that feeling of safety and security. So a few milligrams of lithium every day can also be helpful for people to balance with those high catecholamines. And then niacin has been shown to also be helpful in breaking down neurotransmitters. So this is the magnesium I use. I like to use a magnesium glycinate malate for a few different reasons. And it's quite a calming magnesium. So if I had to pick one to start with, I'd probably pick magnesium, and specifically the magnesium glycinate. And consider with fast COMT, and what you want to avoid with slow COMT is in general things like zinc. Zinc is very helpful as a cofactor to make neurotransmitters. Then tyrosine, which helps make dopamine, and then folates, which also help support neurotransmitter production. Phenylalanine, which also supports dopamine, an Ayurvedic herb named mucuna, which supports dopamine, and SAMe, which also supports neurotransmitter production. And you might ask yourself, well, he just said SAMe is good for slow. Now he's saying it's good for fast. I'm going to get back to that question in 1 second. So I know it's a little confusing. So, and then there are specific supplements that inhibit COMT. Calcium, when there's a lot more calcium to magnesium in the body, you'll inhibit COMT and slow it down as well. So that's where maybe not using magnesium for fast COMT is a better idea, and maybe even adding a little calcium. High iron levels will inhibit COMT, so I don't recommend overloading iron just as a way to inhibit COMT, but it's good to check. because maybe high iron levels could be a reason why a person's COMT is slow. And then there's a test that tests the ratio of S-adenosyl homocysteine to S-adenosyl methionine, or SAMe. And that's a test we can run, and that also will help tell us about what the methylation status of a particular patient is and how well their COMT is running. Because even if their COMT genes are not slow, if their SAH to SAMe ratio is off, it still might not be working well. So, and I know that that's a bit of information and probably past this particular lecture, but I just wanted to leave it there because if you continue on to learn about it, you're going to hear more about that. And then high homocysteine, which is a test that you can take, and when homocysteine's high, you know that probably that COMT enzyme isn't working the way it needs to. And rhodiola is known as an herb that comes from Russia and has been studied in Russian armies, and to be very, very beneficial to help people in very difficult situations kind of move through those situations. Rhodiola is known to inhibit COMT, so probably one of the reasons it does that is because it helps keep those neurotransmitters, those catecholamines, up. Okay, and then this is one formula that actually I formulated, so it's the disclaimer, and I do use it for a lot of patients with fast COMT to help raise their neurotransmitters. So, and it has tyrosine and mucuna, it has SAMe in it, it has a little 5-HTP, because many people are a bit low in serotonin, and apocynon, which is a Chinese herb and is a catechol. But I like this one because it's also very calming. It also produces GABA, so it kind of stimulates and kind of calms at the same time. And then curcumin, which is also a catechol too. So sometimes when, and that's probably one of the reasons why curcumin has been well studied for depression and has been shown to be pretty useful, probably not just because it's an anti-inflammatory, but because it's a catechol itself. Okay, so we talked a little bit earlier about methyl groups, right? And so methyl groups are basically these carbon and hydrogen molecules that when a molecule uses it, and when COMT specifically uses it, right, it donates it to whatever the neurotransmitter it's trying to break down is, and the neurotransmitter hooks onto it and inactivates the neurotransmitter. So it sounds like if you have slow COMT, it would be a good idea to do it, right, to give it. But it really depends, because the other problem is that methyl groups also, through another pathway, help support making more neurotransmitters and catecholamines. So yes, it helps the COMT break it down, but it also helps other parts of the cell's physiology make it. And this is a drawing that shows this system. So I think I have a bigger version of it here. Oh, I guess I don't. So, so basically we have a cycle here, and I'm not going to go into too much detail with this, but there's a cycle here that runs how methyl groups are made and donates it so that the COMT enzyme can break it down. And when we feed the methyl groups, we help that. But when we feed the methyl groups, we're also supporting this cycle, which actually converts the amino acids to the neurotransmitters, things like dopamine, and which gets made into norepinephrine. So you could see the dilemma. So what this means is we really need to be careful when we're using methyl groups. And I know sometimes people look at genes, like the other gene is MTHFR, right? Methyl tetrahydrofolate, methyl tetrahydrofolate, right? And when we have certain SNPs of that gene, people think, oh, well, I need to take a lot of methylfolate. And well, sometimes yes, and sometimes no. So the best thing to do is start really slow, because if we start too fast and we tending to make more neurotransmitters here, then we're supporting methylation here, then we can actually imbalance the person and make them feel a lot worse. And that's the same thing with SAMe. If we give people a lot of SAMe, we might be helping the COMT methylate further. But if this cycle is stuck, will end up making a lot more homocysteine, and you can check labs to see that. And that person will actually start creating more neurotransmitters and catecholamines, but not necessarily methylating to break them down. And that could actually make them more irritable, more angry, and so forth. So sometimes, depending on the situation, it's if you need to use something like B12, we use something like adenosyl B12, which doesn't have a methyl group, or folinic acid, which is folate, but doesn't have, it's not a methylfolate. So again, what's good for one person isn't always good for somebody, for something else. And then, oh yeah, many other genes for methyl groups. Sorry, I messed up this slide a little bit. Okay, there it is. Many other genes to consider. So we have to remember that that Compti isn't the only gene. We talked about MAO before. And there's a whole lot of other genes. There's MTHFR, there's MTRR, there's MTR. There's the genes down here like CBS, which help make glutathione. So none of these genes work in isolation. They work with other genes. And we need to think about them as a whole as best as we can. And as a practitioner, I need to think about it in terms of a person's clinical symptoms and what makes sense. So, okay, I think I made my point. So, and we want to treat the person and not the gene, right? So, unless that person's name is Gene, right? So, anyone know who that is, right? Singing in the rain, Gene Kelly. So, so we want to treat the person. We don't want to treat the gene. Because if we look at COMT and say, oh, that's a slow COMT, okay, so what we want to do is we want to get the more methyl groups, or we might be making a mistake. So because everybody is different and we want to listen to the whole story and really see the situation, look at the blood tests, also look at hormone tests, look at the stress system, look at the hormones there, and then also look at the genes and get a full picture. And then we have the best idea on how to help. And then when we decide to make treatments, especially when it comes to nutrients, we start slow. And then the body, the body has such amazing wisdom. The body will tell us what's working and what isn't working if we give it the chance. And the other thing is, don't fix the problem if it's not broken, right? And why I say that is because sometimes, it's very interesting. We get all these genetic tests, excuse me, and it gives us this information. And then we think we have to fix something, right? If you have a fast COMT and things are going well for you and you're able to function and you're feeling really good and you don't have a lot of cravings, and then fine, and you're working fine, and then don't fix something that's not broken. It means your body has overall, with all the other genes and the nutrients you're taking in, and you're getting everything you need and you're in balance, and it's okay. So it's only if you're finding that there's a pathological issue, you have a mood issue that's not allowing you to live the life you want to live, then that's when you say, okay, let me look at the genes. Oh, look, this gene is a fast COMT, and yeah, I can't focus. And because of that, I really can't even keep my job, and I have all these cravings, and I have to go bungee jumping every other day, and whatever it is. Then and that tells you, okay, well, now that's worth trying to balance, right? It is a little bit broken, so we're going to start to fix it, and then we know how. Okay, so in conclusion, it's basically everything I talked about. We do the intake, we do the blood work, urine work, we get the genetic tests, and then we pick the right lifestyle and diet changes for that particular person based on not only their COMT, but everything else that I've learned about the patient. And as a summary, please remember the COMT gene can either increase stress hormones and estrogens or actually lower them. If you have another one, right? Slow will increase them, fast will lower them. And if you know your COMT gene, then you can start to look at natural remedies to bring balance if you feel something is out of balance for you. And please remember, it's, no need to fix it if it's not actually broken. And please do join me on Facebook and Instagram and Twitter, and join our newsletter too. And I'm also happy, I'm going to put the video back on. I'm also happy to start taking some questions.